Hello, my name is Jon Suzuki. I've been in dental academics for over 3 decades of time, and I've been in the business of educating dental students, residents, other dentists in various continuing education courses. I'm affiliated currently with 4 universities that I hold clinical professorships at: University of Washington, University of Maryland, Nova Southeastern University, and Temple University. And one of my disclaimers is that everything I say in the next few minutes together with you in no way represents the policies nor the opinions of any of these 4 universities. Furthermore, I'm a special government agent with the Food and Drug Administration of the U.S. government. And once again, as a disclaimer, everything I share with you today in no way represents the policies nor the opinions of the U.S. government. I published an article on systematic reviews of peri-implantitis along with my colleague, Dr. Miriam Ting, a graduate of Temple University. A systematic review essentially is an overview of all the published articles in a particular field, and we focused on peri-implantitis, its prevalence, and its primary risk factors. As clinicians are well aware, there's increasing numbers of implant failures in our practice, and certainly peri-implant mucositis, which is a precursor stage of peri-implantitis, is one of the major contributing factors of implant failures. Our prevalence rates were reported to be anywhere from 10 to 30%, which indicates a very increasing number of patients that have implants which are going to fail. We have found various risk factors, which of course we expected, but perhaps one of the unexpected risk factors identified in this particular systematic review were that patients with a previous history of periodontal disease had a higher risk of implant failures also. Now, whether or not this is related to oral hygiene habits or whether it be dietary or genetic changes is not really known. But I think one of the takeaway messages from this article is that certainly dentists should take an accurate medical as well as an accurate dental history of our implant patients and identify those particular patients that perhaps lost their teeth due to periodontal disease. Our group published a series of book chapters in the relatively famous MISH series of textbooks on dental implants. The most recent textbook, published in April of 2020 this year, Contemporary Implant Dentistry, the 4th edition, edited by the late Dr. Carl Misch and also by Dr. Randy Resnick, a professor at Temple University, indicates that there's various reasons and different treatment modalities for implants and implant failures. Chapters 41 and 42 of this 1,400-page textbook leads us to look at different types of implant failures: early stage, moderate stage, and advanced stage of implant failures can all be diagnosed properly, and diagnosed in the earliest stage can be treated and managed more effectively. In the early to moderate stages of implant failures or peri-implantitis, up to now, various surgical modalities have been used, and using compounds of regeneration such as bone grafting material and other types of guided tissue regeneration. However, included in these book chapters introduces another approach, perhaps a more conservative approach, to managing and treating peri-implantitis, and that is the use of the neodymium mag laser. The protocol is called Laser Assisted Peri-Implantitis Protocol, LAPIP for short, which leads to a fairly predictable result on recovering lost implants or implants that are in the various stages of decline.